is that you need to relax. Very easy for me to say because I'm not taking the exams, but it's very important that you understand that you have to relax. When you get very anxious, and this is something common that everybody goes through, they get a little bit of mild anxiety before taking an exam. When you get anxious that you cannot control it, it's going to block your thinking and is going to prevent you from picking the right questions. So try breathing techniques. Try possibly before your exam writing down your concerns on a piece of paper, only for your eyes. Write down everything that you're feeling at that moment. Just let it loose right then and there, and then you can tear that paper up and then go take your exam. Do whatever it takes for you to relax before an exam, okay? There's mindfulness videos that you can watch, maybe listening to soothing music, perhaps some aromatherapy can help, okay? But the point is, try to get relaxed or else anxiety is going to block you. So let's talk about the forms of questions. Normally in any exam that you take, you'll have multiple choice questions. Select all that apply, fill in the blanks, drag and drop true or false questions. We're all familiar with these forms, but we're going to go into a little bit more detail as to how to pick the correct questions. So the first thing I want you to do is to cover the answers. Whenever you are approached with a question, just cover the answers. And the reason I say this is because somehow your brain is trained to look for the answer, like read the responses first before you even know what the question is asking, okay? So do yourself a favor, first cover the answers, and then the next thing you're going to do is you're going to look at the question itself, and you want to think of it kind of like a rose, okay? So we know that the rose has petals and it has a stem. So when it comes to questions, the question format has an event and it has a stem. So the event is what provides you with the information regarding the situation. So it's like the story, okay? It might have vital signs, it might have some information that you really don't need to answer the question. That's why I want you to focus first on the stem. The stem is the actual question, the words before the question mark. So make sure you identify what is your stem and what is your event. So here is an example as to which one is your stem and which one is your event. All right, so I'm going to try to draw here. So your event, okay, should be the story about the question. Okay, so it's going to be what I am circling or trying to circle here in red. This is your event. This is your story, okay? What you want to focus on, and I'm going to change colors to purple here, is the actual stem. First, you're going to look at the stem. Here's my question mark. So I'm going to read the sentence that is before the question mark, okay? So it's all this. The nurse should consider which factors when planning opioid pain relief. All right. So once we decide, once we realize which one is the stem, okay, we need to look at keywords. But before we move on to that, I want you to take some time, and you can pause this video if you like, and figure out what is the stem. Where is the stem? Okay. So I'll give you like a couple seconds to do that. And when you're back, I'm going to underline in purple what the stem is. I'm going to try to underline the best I can, but you get the point. It's the sentence before the question mark, okay? That is your stem. Now, for this video that I'm creating for you guys, do not worry about the actual context of the question, okay? I'm just looking at making sure you understand what is a stem, what is an event. We're not going to answer any questions in this little workshop that we're doing, okay? So we identified the stem, the words before the question mark. Perfect. So the next thing that we're going to do is we're going to determine if the stem is a positive or a negative. Okay, so a positive stem, the purpose behind a positive stem is to see if you can understand or you can apply or differentiate what is correct information. Okay, with the positive stem, they want to make sure that you know what is the truth. Okay, they want to know that you understand that what are the facts. Okay, When it comes to negatives, the purpose behind it is to detect any errors, detect what is false. Some examples that you will see in a negative stem would be the words expect, never, not, contraindicate, further, unacceptable, and void, and least. I almost missed that one, okay? So here an example of a positive stem. So put this video on pause and underline, if you can, your actual stem. So I'll give you a few seconds to do that, and then I'll give you the answers. All right, so the answers are here. What is, I'm going to try to underline, the underlying feeling being expressed by the patient. And then this one is like, the second one is the whole thing is a stem, right? And as you're reading these stems, remember, it's not about the concept at this moment, it's just identifying. You want to also identify what is your key word in the stem to determine, is it a positive stem or is it a negative stem, okay? So you will see that at the bottom of the screen, I have underlined the positive words. Words that make this question a positive question, okay? So for example, expressed most accurately, or the nurse will do, okay? That's an example of a positive stem. And even here in the last one, you can say there's a keyword does not react, okay? Because the nurse needs to determine what she's going to do. The patient does not react. So that's a positive stem. And here's an example of your negative stems, okay? The key words that you would see is avoid, not be done, or least. All right, so now that you've identified what is your stem, you've kind of determined if it's a positive question, a positive stem or a negative stem. What you want to do is take that stem only, okay? You're not looking at the answers. You're not reading the story, okay? Yeah, you're not dealing with the petals. You're still in the stem. You want to take that stem and you want to reword it so that you understand what it is that they're asking. Okay, you want to focus on the topic of that stem. Once you reword it, and then you can rephrase the petal, the question itself, the story. Okay, you can paraphrase it. So number one, identify your stem. Number two is pick out your key word. Number three is to reword the stem. Number four is to read the story and rephrase it. After you have done that, then the next thing that you want to do is uncover the answers, because now you have a better idea as to what it is that you're looking for. All right, so when you uncover your answers, you know always you're left with two really good answers. You don't know which one you're going to pick. Okay, this is where I'm going to show you how to choose the right answer. So of course, you have to go through the process of elimination first. You eliminate all the answers that are incorrect. Okay, you're left with two. Then you're going to reread the question. Make sure do the whole process again. Read the stem, pick out your keyword, rephrase it, and then you're going to look at the story or the petals, okay? And then you can look at the answers you're left with. Make sure you focus on the data in the question and the leftover answers. Do not start looking into questions, okay? And we're going to talk about the what ifs. Okay, so again, here's another little breakdown. The stem was identified, the question was reworded, keywords were selected. You're left with two. How do you know which way to go? Which one's better? Always remember ABCs is priority, airway, breathing, circulation. The only time circulation is number one, okay? It goes above airway. Okay, the only time circulation is priority is when your question has to do with CPR. You also need to remember Maslow's hierarchy, ADPI, and safety. Be very careful where you click, all right? Because last that I remember, when students were taking NCLEX, it wasn't touch screen. It had to do with the mouse. You had to use your mouse to click on your question, on your answer. So just bear with me in my drawing here. I just want to, oops, no, I didn't want him yet. Let me go back. Okay, I'll show you in another slide. I cannot go back. So let's talk about Maslow's hierarchy, okay? This you learned in day 1 from nursing school. Do not forget it. Here's his cute little face so you remember who he is and what he talked about. And of course, your priority is physiological, then safety, love, esteem, up to self-actualization. That is the goal for all of our patients, okay? Any human being, that we need to self-actualize, but we have to start with the physiological needs, such as breathing, food, water, sex, sleep, homeostasis, and excretion, okay? Next, we talk about the nursing process, which is the ADPI. You learned this as well, day 1 in nursing school. Assessment, diagnosis, planning, implementation, evaluation. This is priority. You need to keep this in the back of your mind whenever you're answering questions, because you have to identify, is this an assessment that I'm looking for? Do I need to come up with a diagnosis? What part in the nursing process am I? And then when it comes to therapeutic communication, make sure you always pick the answer that has an open-ended question, because you want the patient or the client to express themselves and communicate with you more. You don't want to use closed-ended questions where you ask them something and the answer is just yes or no, because the whole point of therapeutic communication is to have the patient express and tell you and talk to you and confide in you and build rapport with. Okay, so open-ended questions is priority. Okay, so then let's go to safety. You know, safety is number 1. Lots of medical errors occur because of safety. Patients can fall out of bed. Safety is another issue. So keep safety also in the back of your mind. So these are the tools that you're going to keep with you. Now I want you to take a picture of this so you can save it whenever you're doing your questions. It's kind of like a little cheat sheet. It tells you, like, if you're answering a question that has to do what is a nurse going to do, then you're going to think of the nursing process. If it says what are the client's needs, then you should start thinking of Maslow and his hierarchy, and so forth. So take a second to snap a picture of this. This is good to keep. All right, makes things a little bit easier for you. So when it comes to multiple choice questions and select all that apply, okay? When it's a multiple choice question, you have to read all options carefully and make sure after you have rephrased the stem, that you focus on the event, and it's going to help you decide which of the answers are the best answer, okay? And then, of course, you're going to keep in mind your ADPI, your Maslow, safety, ABCs, etc. that we just talked about. When it comes to a select all that apply questions, and I know a lot of people do not like them because they're a little bit scary, right? If you don't pick the correct answer, if you miss one out of all the select that applies, it's like you don't get a point. So I understand the fear and the anxiety behind select all that applies, but please learn to embrace it, because you will see a lot of select all that applies in when you're taking your NCLEX. So expose yourself to the select that applies. It's a really good tool to train you. Do not run away from it. And you want to look at each option as a true or false statement. And of course, you're going to choose all the true statements if your question is a positive question, okay? And you're going to choose all the false negatives if it's a negative questions. So when you have the option of arranging the nursing interventions, okay, you have to put them in order. You need to make sure you read every choice before answering. Don't just read one and then just move on to the next one. No, read every single choice before you answer. It's very important that you do this so that you don't get confused, because remember, you only have 1 minute per question. And you don't have time to try to rearrange things, okay? So the best thing for you to do is read all your options first, rearrange them in your mind, and then arrange them in the computer. So I'm going to see if I can show you what I was trying to show you earlier, what I was trying to draw. So here we go. When you're picking a question, when you're picking an answer on the exam, okay, let's say this is answer A, this is answer B, and then this is answer C. Okay, look at what's going to happen. Whoever creates these exams, the computer, the techie people, okay, they do things their way. And we don't know what their way is, right? Because we're not into IT. But the point is, you never know where these little invisible lines are going to be, where they start and where they end. Okay? So for example, if you want your answer to be B right here, of course you would click. This is your answer. But if you're using the mouse and now you want to go to the next question, and let's say you click here to go to your next question, guess what happened? This invisible line that is connected to the third answer, okay, it's there. There's an invisible little line with little boxes there, and you might accidentally change your answer from B to C, and now you selected the wrong answer. I see this happen all the time, you guys. Just yesterday, I gave my students 40 questions to practice on, and when I reviewed with them their answers, they're like, how did I choose that answer? That's not right. I know, obviously, that's not the answer. Why did I choose this one? And I always tell them, well, you probably clicked when you weren't, where you were not supposed to, because we don't know where these little invisible boxes and lines are, and then you change your answer on accident. So I highly, highly encourage you to click somewhere else, okay? Let's say you want your answer to be A, okay? Let's say I'm gonna pick A. I'm gonna click on the little button. Now I wanna go to the next question, and I'm gonna go somewhere in the corner, somewhere far away from where my answers are, and I might click over here just to go to the next question. That way I'm completely far away from the answers and from potential little invisible boxes and lines. Okay, that's what I was trying to show you earlier. Be careful where you click. Okay, so these are some things that you need to do. Always take a deep breath in. It relaxes you. I know taking exams can be scary, but you have to learn to deep breaths in and relax. Make sure you cover your answers. Somehow your brain plays little tricks on you and you want to read the answers before you even know what the question is, okay? Be careful. Don't do that. So you're going to read the event or the story. You're going to reword, okay, the event as well, okay? When you're reading the event, you need to make sure you read slowly and try to visualize what the event is showing you, because now you could see it. Okay, so visualize what you're reading in the event. When you're looking at the STEM, okay, make sure you, first of all, know what the STEM is, which is a word before the question mark, and then pick the key words that pop up on the actual STEM that stand out, okay? Determine, is it a positive question? Is it a negative question? Are they asking me true statements or false statements? What do they want from me, okay? And then you're gonna uncover your answers. Remember to use your ABCs, your ADPI, your MASL, your safety, and most importantly, eliminate the what ifs. Do not do what if this, what if that. If you're working in the medical field already, or you have any kind of experience in the field, even if you've been to clinicals, okay, be very careful. Do not let those experiences take over your exam. Because what happens is like students will read a question and then they associate that scenario, the event or the story, they associate it with the experience that they had at the bedside, and now they start to overthink and they start to think like, okay, but what if this patient has this? And then what if the doctor comes in and the doctor says this? And then you find yourself in this whole like craziness of like, what if, what if, what if, what if? It's gonna throw you off completely. So learn from day one how to like block off the what ifs. If you catch yourself at any point thinking, overthinking, or thinking outside of what the story says, then you need to stop. You need to breathe again and start over. Start over, okay? Pick your stem, reword it, look at your event, reword it, visualize it, and start over. Because if you start with the what ifs, it's gonna throw you off and you're gonna mess up. Okay, the other thing I wanted to bring up is the timer. By now, you should be comfortable with a timer being on your computer because you've done it in nursing school. If you've taken NCLEX already, you know that there's a timer. If you're not used to the timer, what I suggest students to do is when they are studying either with their book or their computer, they should have a timer next to them. So if you're only studying NCLEX questions from a book, take your phone, put your timer next to you, and just have it sitting there so that your eye and your brain get trained that there's a timer there. At first, you'll be a little anxious about it, but you'll see after a while, it's like you block it out. Okay, if you're on the computer, then download a little app that will give you the timer so you're used to it being in the corner and you don't freak out the day of the exam. Now, everybody says you have 1 minute per question. That is very true. Okay, if they're going to give you, just like a nursing school, if we're going to give you 40 questions to answer, we're going to give you 40 minutes to answer. NCLEX will, their timing is a little different, but more or less they say it's a minute. Okay, so what I want you to do is to, of course, focus on the 1 minute per question, but keep this in mind. You might answer a question in 30 seconds, okay? Then you have 30 seconds left over, which is going to add up to that next minute that you have to answer the question. So really, the next question is 1 minute and 30 seconds, okay? It might take you a little bit longer to answer. It might take you a little bit longer to answer the next question over 1 minute and 30 seconds, but that's okay because the next question might take you 10 seconds to answer. So you can play with the time a little bit. Don't get so fixed on the time because there is a little flexibility depending on how fast you answer questions, but be mindful that it's there, if that makes any sense, okay? Practice with your timer, but you'll realize that at some point you're answering questions that are like, they take you like 10, 20 seconds to answer, then you have extra time left over that goes in the back of the total time, okay? So I hope that helps. Okay, so now we're going to go into the next slide, which is the keywords. All right, or they're called strategic words, keywords, same thing, same difference, okay? Like I said, first you're going to locate your stem and pick your keywords. Now, if you're looking at your event, okay, your event might have keywords as well. There's certain things in events that you need to know. So if they're asking you a question about patient status, what is the next step? You might have to know what the vital signs are. So you have to, that's like your keyword. What are my vital signs, okay? So just be open-minded. There are keywords in the stem and there's keywords in the event. Okay, some keywords indicate all the answers are correct, therefore you need to prioritize. So be very careful, be very cautious here. So on the right-hand side of your screen, you'll see that these are common strategic words that indicate the need to prioritize and words that reflect assessment. So try to review this, okay, box 4.4. Try to review this so that you will get better at picking out your keywords in either your STEM or your event. Okay, so let's practice. Again, it's not about the content. I don't care if you know about hypovolemia or you don't know. It's not about that. It's about picking your keywords, okay? and then we'll talk about it. So pause this for a second and look at your stem, identify your keywords. That's all I want you to do. You don't need to answer the question. But if you really want to know the answer to the questions, I have it here for you. I have the answers available. So go ahead, work on that for a minute, pause this video, and then hit play so you can see the answer. All right. So your STEM is the nurse should monitor for which early sign of hypovolemic shock. Okay, that is your STEM. Is this part over here? The nurse should monitor, okay? Which early sign? Okay, so what is your keyword here? Keyword is early sign. Okay, that's your keyword in your STEM. So now let's rephrase this into what are they really asking me? So let's see, let's read it first. The nurse should monitor for which early sign of hypovolemic shock. So I would rephrase it to something like this. What early sign can I find in a hypovolemic patient? Example, okay? Now that I have reworded and understand what it is that they're asking me, I'm gonna look at my STEM, the story, the event, however you wanna call it. I'm gonna look at it and I'm gonna determine what is it that they're telling me that I need to know to answer this question. Okay, but let's, again, it's not about the content, it's about the keywords. So let's read it and pick the keywords, if there are any, okay? The nurse is caring for a client who just returned from the recovery room after undergoing abdominal surgery. So keywords would be just returned, okay? Because that tells you, because you're visualizing this as well, right? So you're imagining that the patient just returned. They just got here. They just got off the stretcher. They just put him onto your bed, okay? Returned from the recovery room after an ongoing abdominal surgery. So another keyword would be abdominal surgery, because now you know they just got on your bed. They just had abdominal surgery. So now I need to look at the early signs of hypovolemic shock, and that should help you answer the question, okay? So let's go to the next slide. This is the what if syndrome that we talked about, okay? But let's practice. Now pause this presentation and practice picking your keywords and your STEM. And if you have any keywords in your event, pick those as well. Oops. Okay. All right, so here we are. Here's another question. This is about ABCs. So in the STEM, the nurse should employ which priority action in the care of a client? So pause this presentation and then come back and pick your keywords in your STEM. And if you have any in the event, pick those as well. So I would say that in this question, the STEM has a keyword of priority. Okay. And for the event, I would say the keyword is receiving morphine sulfate. Okay, those would be my keywords. Receiving morphine sulfate and priority. You can even say priority action, that's fine. But you know priority is the keyword. And then that's going to help you answer your question. Okay, there's the answer if you really need to know. There's your answer. All right, here's another one. This one is only a question. There's no pedal, there's no story, there's no event. So the nurse caring for a client experiencing dystocia determines that the priority is which action. Keyword is priority. Okay? Not action, but priority. I could see why some people would maybe pick action because it tells you like what should you do, but really the word that weighs more is priority. Okay, here's another one. So the STEM is, what action should the nurse take first? At this point, you should be able to pick your keyword super fast, okay? So this keyword is first. All right, and then for your petal or your STEM or your story or event, whatever you want to call it, what would your keyword be? I would say it would be cast and pain. Those would be my keywords. Okay, here's your answer. All right, this is another question regarding the nursing process, okay? Which would be your keyword? At this point in this presentation, you probably just look at the question itself and already, just like that, you know what the keyword is, okay? So your keyword is priority. Okay, there's no event, so no other keywords. And over here is the answer if you want to know. Okay, here's another one. This is a pretty long one. So we're going to look at the STEM and we're going to pick our keyword. So the STEM is, the nurse should take which action next. So what is your keyword? I would say the keyword is next. Okay, action, it could be action next. That's not too bad. But which one is a more important word? Next, because whoever wrote this question can very easily change that and say the nurse should take which action last, okay, for example, or which action first. So do you see why next is a very important word? Okay, so now let's read the event and see what keywords we have there. The nurse is caring for a hospitalized patient with angina pectoris who begins to experience chest pain. The nurse administers a nitroglycerin tablet sublingually as prescribed, but the pain is unrelieved. So I would say that the keyword here is angina pectoris because that's what they're having. And I would say pain, chest pain. And I would also say unrelieved. So now you know those are the important words. Okay, so knowing those important words, you should be able to answer this question. All right, so the morning of the exam or the day of, if you're taking the evening classes, evening tests, okay, the day of the exam, you need to continue your daily routine. Wake up early or if you might want to take a nap before you go and take this test, if you can, okay, just to give your brain a little rest. Practice relaxation techniques. Have your supplies for the test. So when you go and test, they're going to want you to show your driver's license, your ATT, which is your authorization to test. For NCLEX, they usually search you. Like they will say, empty your pockets. Let me see your glasses. Let me look at them because they will take your glasses and they will look at them to make sure they're not special glasses that give you answers. I don't know what kind of glasses are out there, but they check the glasses. Sometimes they'll even check behind your ears to make sure you don't have anything there that might be used to cheat. They will give you a locker and they'll tell you that in this locker you can put water, you can put a snack, you can take a break whenever you want. But if you take a break, the clock keeps ticking. Okay, so remember that you can take breaks. If you need to go and like stand outside of the testing room for a little bit and just breathe different kind of air, you can do that. Now these were the rules before COVID. During COVID and after COVID, some things have changed a little. So I really encourage you to, wherever it is that you're testing, you go and you speak to someone or you read on the internet, like what is their process? What are their requirements? How is it going to be? I highly encourage you to drive to the site the day before so that you know where it is. You have an idea how far how far it is from your house, how long it's gonna take you, what does it feel to be walking down this hallway. You know where it's located exactly, so you're not running around trying to figure it out the last minute, and it kind of gives you a little bit of peace. So try to do that. Okay, make sure you empty your bladder, because the last thing you want to do is have to go to the bathroom or hold it. Okay, and I don't know about the masks, that really depends on what their routine is, but I really, really want you to encourage you, even if it's not your NCLEX, if you're taking like a regular exam, write down your frustrations on a piece of paper. You can do this in your car before you go up to take the test. I read this article somewhere and I wish I could find it, because it was evidence-based practice that they were saying that if you write down your worries, your frustrations right before an exam, you just write it all down. This paper is just it's for you. It's your little secret. No one's going to take this paper from you. No one's ever going to read it. Let it all out on that paper. And I prefer for you to do this in your car, because sometimes our frustrations and our worries gets us very emotional. And if we need to cry, we'll feel better crying in our cars than crying in the classroom, or crying in the testing site. Okay, so do this privately. Let all that out, write it down, and then just rip it up, shred it into little tiny pieces. Nobody will ever see it. You can burn it if you want. But the point is, once you leave all those frustrations, worries aside, you will think so much clearly, you'll be better prepared, and you'll do so much better on your exams. So I really encourage you to do this. All right, so here are some tips, okay, just to help you remain calm and make sure you can believe in yourself that you can do this, okay? So I always suggest students to, as they're preparing for NCLEX, you're always keeping track of what you know, what you don't know, right? Some people have little booklets and they can write little notes as to what is it that they miss on a question, what do they need to reinforce, okay, etc. You know what I'm talking about. Some people do flashcards, but I suggest you write it wherever, however you want to write it, or even in the computer, but you need to record your notes. Okay, record things that you're not good at, like your deficits, record them and listen to them. Even if you have to listen to them while you're sleeping or before you go to bed, somehow information sticks. And I promise you it does, because I know it worked for me during nursing school. And I tell my students now, as they're preparing for exams, because they are in nursing school, and some are preparing for NCLEX, I tell them, just listen to your recordings and like, trust me, something will stick. And sure enough, they come back and they're like, oh my gosh, I answered this question. I don't even remember learning about there, how I kept it in. It just, I was able to answer it. So I highly think it's the recording that helps a lot, okay? Get into groups. This part is super, super important. Get into groups and teach each other. You know that when we are teaching our patients something, we always use the teach back method, where we show them how to do, let's say, empty Foley's. We show them how to do it, we teach them, and then we ask them, okay, now you teach me, you show me. And when they do that, you're able to determine if they understand or they don't understand, and they catch themselves if they don't understand something, right? So it's the same thing when you're preparing for these exams, is that you want to get into a group and you want to discuss topics. And as you're verbalizing, and maybe if you're using a whiteboard and you're drawing, you will catch yourself and the things you don't know. And that's what you want to write down and take notes and research more and record and listen to. Okay, so you get better at it. So teach back, and at a student level, is highly important as a teach back at the bedside. Review the hot topics from any assessment that you're using. I don't know what platforms you might be using to prepare for this NCLEX or exams. If it's UWorld or Passpoint or other ones that are out there, I don't even know. Whatever, there has to be somewhere where you can get information as to where your deficits are, and you want to review those hot topics. Okay, and don't forget to sleep and eat. If you do not sleep enough hours, your brain is not going to function properly. Okay, do not try to cram everything at one time. It's not going to work. Make sure you eat. You need energy. Okay, your brain needs the calories and energies. Just eat whatever it is. And don't forget about self-care. If you need a break, take a break. All right, so those are my tips for you. And keep calm and believe that you can do it, because you can. So many people have passed nursing school, so many people have passed NCLEX. You can too. Lots of people have had obstacles and they've gotten around the obstacles to pass and achieve their goals. So you can do that too. All right? You have to believe in yourself. You can do this. If you made it this far, nothing is going to stop you. If you're into social media and it's taking up all your time, guess what? You need to get rid of it. All right, you might have little withdrawals, and I get it because there's an actual association to social media and addiction. I totally understand that, but it's going to be temporary, because once you pass, once you're done, you can live on Facebook every single day of your life, every minute of your life if you want. But for now, put it to the side. Do something else. TikTok, get rid of it. Those same videos are there. Okay, think about it this way. Those TikTok videos that you're watching over and over and over again, okay, it's wasting your time and you're making someone else become like a millionaire. So think about that. Put it to the side and then deal with that later. So the last thing I want to do is talk about these resources that I have for you. These are websites that I've found throughout the years. And testbankgo.info gives you lots of books, lots of questions. ABG Ninja is for ABGs, practical skill, clinical skills. You can practice listening to heart sound, lung sounds, etc. And then purpose games, you can look for labs. There's also purpose games for fluid and electrolytes. And nursebuff.com is a platform where they have lots of nursing games. So use those resources. Do not waste your time on things that are not going to be on your NCLEX, okay? So